Well, I was hoping that Jonathan could lead today's presentation since he is clearly much closer to collecting Social Security and Medicare benefits than I am.
Nice.
But nonetheless, here I am. But all kidding aside, Social Security is often the primary source of income for retirees, just as healthcare costs are the primary expense. So we designed a workshop that incorporates both of them, so hopefully when you leave here today, you'll feel educated and empowered to take action.
Well, good morning, everyone. Thanks for coming. So we help a lot of people get ready for retirement, right? Retirement, you're no longer working. It sounds really exciting to me. A lot of people are nervous about the idea of retiring. Well, what happens when you retire? What else stops? Your paychecks, right? No longer allowed to collect a salary anymore. Social Security for a lot of people is their only source of guaranteed income throughout retirement. We rarely see pensions anymore. It's more unusual to see a pension. So making the right decisions concerning when you start and receive your Social Security benefits is paramount to ensuring a good and healthy retirement.
So Social Security, we hear about it all the time. How much can we get? When will we get it? Will it run out? Today we want to focus on a couple of key areas. First, we're going to talk about how your Social Security benefit is calculated based on your earnings record. Then we'll talk about spousal benefits, whether you're married, divorced, or widowed. And finally, we'll briefly mention two adjustments to Social Security, the windfall elimination provision and the government pension offset. These affect folks with public pensions.
So Social Security, it all starts with your benefit statement. In your package today, you have a hypothetical statement for Wanda Worker. Has everybody seen one of these or been sent one of these in their lifetime by Social Security? You used to get them every year, right? A few years ago, Social Security Administration changed that practice. They now send it to you in every big 5-year anniversary. So if you turn 50, 55, 30, okay, you'll get one of these. A little bit younger than me. We encourage you to sign up, though, for an online statement, okay? You can go to online at www.ssa.gov. This gives you access to your full working record. You can find out what your benefit statement is, the history, okay, the Social Security knows of your work record. Make sure this is accurate. Review this, please.
Has anyone here signed up online? Just curious. Yeah, great, okay. So if you do sign up online, they'll stop sending paper statements to you, but you get an email once a year reminding you to go in and look. So Social Security, in order to be eligible for retirement benefits, you have to have 40 credits. One credit is equal to $1,260 of wages or self-employment income in 2016. You can earn 4 credits per year. Now you can earn them at any time during the year. It used to be that you could only earn 1 credit per quarter, but now you can earn them anytime. So we just ended the summer here on the Cape, right? We have a lot of seasonal workers. Let's say that you have a summer job and you earn $6,000. You would earn 4 credits for the year. So if you need 40 credits and you can earn 4 per year, then you have to work for 10 years to become eligible for benefits. But as my example shows, you really don't need to make a lot of money. And if you're married, you may be entitled to spousal benefits even if you haven't earned enough credits. And we'll get into that later.
So your Social Security benefit, where do they come up with this number? Okay, when you see Wanda Worker's statement here and you see 1,767 as her benefit at what they say is full retirement age. Full retirement age is what your benefits are based off of. So if you started early, it's a reduction in that benefit. And we'll talk through that in a minute. How do they come up with that number? How do they come up with your number? What they look at is your 35 highest years of earnings. So the question we get a lot is, well, what if I only worked 30 years or 25 years? What do they use for those other years? They use 0. Okay, so obviously that'll bring your benefit down. And what they do is they index or inflate those earnings to today's dollars. So let me make an example. Let's say you started work and you were making $18,000 a year. Every year you got a 3% increase in salary. Believe it or not, in 35 years you'd be making $50,000. So in today's dollars, right, 35 years of $50,000, 35 times 50 is $1.75 million. Even though you earned in those dollars a lot less than 1.75, maybe you earned less than $1 million. Today's dollars, it's 1.75 million. From that, they divide that by 35 years of months. Okay, or 420, that's why you see that divides there, 420, to get what's called the average indexed monthly earnings. Okay, it's kind of a mouthful there. That number there is $4,166.
So Jonathan, that 4166, is that my Social Security benefit?
That'd be great if it just stopped there, right? That would be, well, not easy, but at least understandable, right? But they don't stop there. And actually, what is the highest benefit you can get right now retiring, Melissa?
So in 2016, the maximum benefit at your full retirement age is $2,600 a month. So if you are a high wage earner, they'll actually cap out the maximum benefit you can receive.
Okay, so remember, this is part 1 of the calculation. We have that 4,166. With that, they apply what's called a tiered system. First tier, up to $856, is multiplied by 90% or 0.9. That's where you see the 770. The next tier, up to $5,157, multiplied by 0.32, 1,059. Now this AIME was not as high to use a third tier, okay? It was below 5,157. If you had to, multiply that last number by 0.15. And again, there is a maximum benefit, as Melissa mentioned, at your full retirement age. Anyone retiring now, your full retirement age is 66. They start to slide this up, so by the time Melissa and I, what is it, 70 years from now when you retire, Melissa, okay? It will go to 67, okay? But 66 to 67 eventually is the full retirement age. So here, total monthly benefit, $1,829. That is how they would calculate your benefit. Any questions on that calculation? It's kind of complicated. So then I'm sure you've heard you can start taking Social Security early, right? You don't have to wait till your full retirement age. What happens to your benefit? Well, as you might imagine, there is a reduction in benefit. Every month you take it early, it's reduced by a certain amount. So let's make an easy example here. Let's say your full retirement age benefit is $1,000. It's not a huge benefit, but we see this a lot, $1,000. Earliest age you can take your Social Security benefit, and there is one called the survivor benefit, you take a little bit earlier, we'll talk about, but your benefit is 62. If you take it as early as you can, it's a 25% reduction, a little over 6% a year. So if your full benefit at full retirement age was $1,000, at 62 you get $750 a month. Conversely, if you delay getting your benefit, you get what's called delayed retirement credits. It grows 8% a year. So instead of $1,000, if you wait till 70, and that's the maximum age you can delay, okay, beyond that they don't give you any credit. 8% a year, 32%, instead of $1,000, $1,320 a month. So you can see between those 8 years, 62 to 70, your benefit almost doubles. Now, for a lot of people, right, if you're retiring, you need cash flow, this is almost impossible to wait. And to give you an example, over 2/3 of people take their benefit early, before their full retirement age. Anybody want to guess what percentage of people wait till age 70? Any guesses? Between 1% and 2%. Okay, so very few people can wait till age 70. And a lot of it is cash flow, you need the income, okay, so we understand that. But it can pay off powerfully to wait, and we'll talk about some of those strategies a little bit later on.
So as Jonathan just mentioned, 2/3 of people end up taking Social Security early. Now what happens if you do that but you decide to work? That seems like a pretty good strategy, right? You're going to have your earned income and now you have another stream of income in the form of Social Security benefits. Well, unfortunately, the Social Security Administration has some rules in place for this. So if you start collecting below your full retirement age, say it's 66, you can earn up to $15,720 without your benefits being impacted. That maximum earnings is indexed for inflation too, so each year it does get a little bit higher. If you earn more than that, then your benefits are reduced by $1 for every $2 above that maximum. I will get into an example in a minute to clarify this. Once you reach the year that your full retirement age is attained, so say your birthday is in June, you'll turn 66 in June, from January until June, you can earn $41,880. For anything above that, then your benefits will be reduced by $1 for every $3 over that. Clear as mud, right? So here's an example. This is Ted. He's 62, and he's going to start collecting his Social Security benefits. He's going to be receiving $1,000 a month. Ted's also going to continue to work, and he just happens to know how much he's going to make for the year. He's going to make $25,720, which just happens to be exactly $10,000 over the maximum. So we said before, if you start collecting before full retirement age, your benefits are reduced by $1 for every $2 over the maximum. So we take the $10,000, divide that by 2 is $5,000, or 5 months worth of Social Security benefits. So rather than prorate that $5,000 over the course of the year, they'll actually stop sending him benefits. So for 5 months, Ted won't receive any Social Security at all. But don't feel bad for Ted and his lost benefits. What happens is once you reach your full retirement age, they'll actually recalculate your benefit and they'll add back any benefits that weren't payable to you. So the takeaway here is if you are thinking of collecting early and you're going to continue to work, talk to the Social Security Administration to understand these different maximum earnings limits so that your benefits aren't impacted. Any questions on that? Nope. Okay. Okay,
now let's turn our attention to spousal benefits. So let's imagine that Melissa and I got married and I never worked a day in my life. Okay, I like this idea, I usually like it. Okay, I would be entitled to a Social Security benefit just based on the fact that Melissa worked and had a Social Security benefit. That'd be called the spousal benefit. As her spouse, I'd be entitled to a benefit. How would I qualify? If I'm married for 12 months or more to Melissa, we're still currently married, if she's receiving a Social Security benefit, I can then apply for a spousal benefit. Now, let's see here. Okay, let me walk you through an example here. Okay, so here is a little slide about Jack and Diane. Okay, both full retirement age 66. They're both 66 years old. Let's see, Jack's full retirement age benefit is $2,000. Diane didn't work as much in her lifetime. Her full retirement age benefit is $800. Let's say they both go to apply for Social Security at the same time. Jack gets $2,000. What would Diane get? Well, the maximum spousal benefit she can get is 50%, half of what Jack's full retirement age benefit is. Okay, so at $2,000, Diane could get up to $1,000 based on his working record, even if she hadn't worked. In this case, she does have her own benefit. So how will they calculate this? They'll send her a check for $1,000. $800 will be her own benefit. Then they'll send what's called an excess spousal benefit of $200 for a total of $1,000. Now, a question we also get a lot, and we see a lot, is let's say Jack starts taking his Social Security benefit early, right? Let's say instead he doesn't wait to 66. Let's say he waits 62. As soon as he can, he takes his benefit. Now, we know the maximum reduction there is 25%. So instead of $2,000 a month, Jack would be getting a check for $1,500 a month. So does that mean Diane can only get half or $750? Actually, no. She's still entitled up to $1,000 if she waits till her own full retirement age of 66. She can get $1,000. Now, if she elects, and this is where it gets a little tricky, if she elects to get her spousal benefit early, that gets reduced. Even more than your own benefit, to 30%. Okay, so if she decided to get her own that benefit, instead of $1,000, she would get $700. Okay, so she get much more reduced benefit. Any questions on this spousal benefit here?
So what if you were married but you're now divorced? Are you eligible for a benefit on your ex-spouse's record? Well, the answer could be yes if you meet certain requirements. So first, you have to have been married for 10 consecutive years or longer. You must not currently be remarried, and both you and your ex-spouse must be at least age 62. Your ex-spouse does not need to be collecting in order for you to get a benefit on their record. If that's the case, you just have to have been divorced for 2 years. So here's an example. This is Christine. She's 65 and her full retirement age is 66. She's thinking about collecting next year. On her own record, she'd be entitled to $1,000 a month. Now, Christine was married a long time ago to a guy named Sal. They were married for 12 years. They got divorced. She hasn't thought about him for a long time. But Sal just happened to be a high wage earner. He's getting the maximum Social Security benefit of $2,600 a month. So can Christine collect on Sal's record? Well, let's see. They were married for at least 10 years. They've been divorced for 2, and they're both over age 62. So Christine would be entitled to 50% of Sal's full retirement age benefit, or $1,300 a month. Now, the nice thing about collecting on an ex-spouse is that they don't have to know that you're doing this. You just go to the Social Security office, bring your marriage certificate, divorce decree. They can access their record and let you know what you're entitled to. Furthermore, Sal's benefit is in no way impacted. Now, let's say that Sal got remarried and his new wife is going to collect on his record. She can do that. Christine can do that. He can have multiple ex-spouses and a current spouse all collecting on the same record without his benefits being impacted.
Yeah, we see a lot of people forget about this possibility, right? Maybe they got divorced a long time ago and they don't want to think about their ex-spouse anymore, right? It happens, okay? But you should be aware of this possible benefit.
Mm-hmm. So finally, we'll look at survivor benefits. In order to be entitled to survivor benefits, either on a spouse or ex-spouse's record, you have to have been married for at least 9 months. Now, the big distinction between survivor benefits versus the other two we just talked about is that you can start collecting as early as age 60. If you do collect at 60, your own benefits will not be impacted. So let's say that you're 60 years old and you're a widow. You can start collecting a discounted survivor benefit based on your spouse or ex-spouse's record, and you can let your own benefit grow. So at 66, at your full retirement age, you could switch over to your own benefit. If you wanted to wait until 70, you could collect delayed retirement credits and then switch over to your own benefit at age 70. So there's a lot of planning opportunities that happen with survivor benefits, and we find that a lot of times benefits can get lost on, or left on the table because people don't realize that they're entitled to these, they're going through a hard time, and so they're not necessarily thinking about finances or Social Security.
So if someone is working under those circumstances, do the same rules apply
Yes, yeah, that's a great question, and that's another reason why people don't always take advantage of survivor benefits. Those earnings limits that I mentioned earlier, the 15,780, that also impacts survivor benefits. So if you're continuing to work, you wouldn't receive a survivor benefit if you're earning over that amount, or it would be reduced.
And that's a great question. We do see that a lot with spouses that are still working in their survivors. Yes?
If both people are collecting and one passes, what happens then as far as survivor benefits?
So let's
the next slide.
Yeah, well, I'll show you the next slide here. Okay, but we'll hold that thought because we'll go into that too. Okay, so let's meet a couple. Well, let's meet Sarah. She's age 68. She was married to Peter. Okay, Peter was a high wage earner, had a really high Social Security benefit, and he delayed getting Social Security. So he didn't get Social Security until age 70. He died at 73. He was collecting $3,270 at the time of his death in Social Security. Very high benefit. Sarah, who was 68, was collecting $1,600. As soon as Peter passes, what happens to Sarah's benefit? Sarah's benefit leaps up to what Peter was getting at that time. She will get $3,270.
Does that happen automatically, or is there another reapplication process?
It should happen, okay, but you should be aware of it, that you want to be up on this, okay, because we see a lot of people, especially obviously widows, very, very emotional time. You're not thinking about money, okay, so this is what you should be aware. They should be doing this, raising your benefit. So this is one thing we do. If we see a couple come in a lot, one of them is a high wage earner. Often in the past it was the man who earned more, but now we actually see both. We try to encourage that high wage earner, the highest Social Security benefit, to delay till age 70. Why? Because that higher benefit falls to the couple for the rest of their lives. Whoever lives the longest, that benefit will follow them. So believe it or not, 65-year-old couple, there's a 50% chance one of them will be alive at age 90. Okay, so this pays off as soon as you hit, say, 81, 82. Okay, it's kind of where break even, it works mathematically. So if one of you can delay, especially the high wage earner, it really pays off to do so. Any questions on the survivor benefits? No? Okay.
All right, so we'll finish Social Security with a section on adjustments to Social Security. First is the windfall elimination provision. Now, does anyone here have a public pension? Maybe you were a teacher, you work for the municipality. So you may have heard of windfall elimination provision. No one likes this, right? This impacts your own Social Security benefits. It's pretty complicated, so I'm going to walk through an example. So Cindy is a teacher, and she's 64 years old. Her full retirement age is 66. She gets a Social Security statement, just like Wanda workers or the ones that you receive. On the statement, it says that at her full retirement age, she's going to get $770 a month. She thinks this is great. She's going to have her teacher's pension. She's also going to get a Social Security benefit. Unfortunately, she's going to be impacted by WEP. So the way that this works is they look at what's called your substantial years of earnings. This is when you work in a job where you're paying Social Security taxes. So maybe you're working in the summer or you had a part-time job. If you have less than 30 years of substantial earnings, then the multiplier in that first row is going to be reduced. So earlier Jonathan talked about how your benefit was calculated, and this multiplier before was 90%. So if you have less than 30 years of substantial earnings, the multiplier drops down to 40. That's the lowest it can go. So they take the 40% and they multiply 856, her AIME, to get $342. So instead of getting that 770, she's actually getting the 342. But her Social Security statement isn't WEP adjusted. So the only way she knows this is when she goes to collect or she talks to other people. So this is sort of a frustrating provision that's out there. They've tried to pass legislation to change it. But if you are impacted by this or know people who are, it's important for them to know about this because this is a big sort of loss in income if you're expecting to receive 770 and you're only getting 342.
And we see a lot of this. Both my parents are teachers. They're both affected by this. Okay, so it's pretty common. So the other adjustment of Social Security, the windfall elimination provision affects your own benefit. The government pension offset or GPO affects your spousal benefit. So let's make an example because this is pretty complicated. So here's William. His full retirement age benefit is $2,000. Okay, that's what he'd get at full retirement age. He was married to Linda, who was taught as a school teacher. She has a public pension. She gets $1,500 a month, $18,000 a year, right? Not a big pension. So she's like, well, I know I'm eligible for half of William's Social Security there, so I can get maybe $1,000 a month, $12,000 a year, pretty good. Well, guess what happens? Because of the government pension offset, it calls for an adjustment in her spousal benefit based on her pension. They take whatever her monthly pension amount is, and they take 2/3 of that number, and they reduce the possible spousal benefit by that. So remember, her maximum spousal benefit here is $1,000. They reduce that by 2/3 of $1,500, which is $1,000, and we made this easier. So what does she get? She gets zero. She gets nothing, okay? Now this to me even seems, more, right, a lot worse. Now, another question, we talked about survivor benefits. Let's say William passes away a couple of years later and he was getting $2,000. Linda's still eligible for a survivor benefit, but it is adjusted by the government pension offset. So you would have $2,000 minus the $1,000. So she would still get a survivor benefit, but instead of $2,000 a month, it'd be $1,000 a month. It'd be greatly reduced.
So it's important to know that the GPO for spousal benefits can reduce them to zero, but the WEP for your own benefits reduces benefits, but they can never go to zero.
So this concludes the first half of this morning's workshop on Social Security. The big takeaway here, like you see this boy at the pool, don't just jump into Social Security. Really understand your options, run the numbers, evaluate your choices. We offer a consultation, complimentary, just so we can look at your situation, help you make the best recommendation.
Any questions before we get into Medicare?
Yes?
When do they use the government pension offset, and when do they use the windfall elimination? What's the difference between the two?
So the windfall elimination provision affects your own benefits. So if you worked for like a government agency or a teacher, you don't pay, in Massachusetts, you don't pay Social Security taxes. And then the government pension offset is if you were collecting a public pension, but your spouse had a Social Security benefit and you wanted to collect a spousal benefit on their record.
Yep. And sometimes we see both. Like my mother was a teacher. She's affected by the windfall elimination provision for her own benefit. Okay, my stepfather passed away. Her possible benefit off his record is affected by the government pension offset. So they look at both and go, what's the higher number she get? Okay, now, yes?
Nantucket and Hyannis would like you to repeat the question that comes from this audience.
Oh, okay.
When you get it so that they can
Okay, you
Sure.
got it.
understand what you're
Sure,
Okay.
sure. So just as Social Security is possibly the greatest source of income you have in retirement, what do you think your biggest expense will be in your retirement years? Healthcare, right? And I can guarantee it'll go up every year. So your healthcare costs at 65, by 85, they'll be a lot higher. We see it every year it goes up, okay? And what you need in healthcare expenses goes up. So today we want to talk about strategies for approaching paying for healthcare in retirement. Healthcare costs and your healthcare strategies in this country all starts with Medicare. Okay, Medicare is the foundation of any strategy you have in terms of paying for healthcare costs. So today we're going to talk about what is Medicare? What does it cover? What is the cost of Medicare? When and should you enroll in Medicare? Then we'll talk about, is Medicare enough? Do you need a supplemental plan? Do you need something else to go alongside Medicare to help pay for the costs?
So traditional Medicare Parts A and B were created under the Medicare Act of 1965. So this program has been around for a while. Similar to Social Security, you need to have worked for 10 years in Medicare-covered employment. If you did not work but are married, then you can actually get Medicare benefits through your spouse. You have to be a citizen or a resident of the United States, and there are some people who can collect Medicare benefits before age 65. These are folks who might have a disability, so that's beyond the scope of today's discussion. Today we're going to focus on Medicare for retirees.
So we talk about Medicare. What is original traditional Medicare? Okay, there's two parts, parts A and B. Now, if you've worked during your life and you got a W-2 statement, you know how you paid into Medicare? What does that go to? That actually has been going to Part A, which is inpatient or hospital care. So you've been paying into that all your working life. So when you retire and you go to apply for Medicare, believe it or not, Part A is free to you. Okay, you can get that at no charge. Part B is what most people think about when they hear Medicare. This resembles more of a traditional health care plan in a lot of ways. This covers doctor and outpatient costs. This is the one you pay a monthly premium check for when we talk about Medicare. Parts A and B are traditional Medicare. We'll also talk today about Part D, which is a prescription drug coverage, which is entirely voluntary, okay? But you do need Part A and B to get Part D.
So Medicare Part A covers stays in a hospital or skilled nursing facility. Does not cover long-term care expenses. This is a popular misconception. If you have limited assets or income, then you might qualify for Medicaid, which does provide long-term care coverage, but traditional Medicare does not. So for a hospital stay, let's imagine that I'm 70 years old and I've had a fall. I'm admitted to the hospital right away. It was a really bad fall, so I'm going to be at the hospital for 100 days. How much am I going to have to pay out of pocket? For the first 60 days, I will just pay a deductible of $1,288. That's for 2016, so every year that does grow incrementally. For the next 30 days, from 61 to 90, I'm going to pay coinsurance. you'll be paying $322 a day. Now that seems pretty steep, but if you compare that to the actual cost of a hospital, say in Massachusetts, about $1,800 or so a night, it seems a little bit better. Once I've passed the 90 days, I'm going to use 10 of something that's called my lifetime reserve days. Now, I only get 60 of these in my lifetime, so for my 100-day stay, I'll use 10 of these, and I'll be paying $644 a day for co-insurance. So during your lifetime, you get something that are called benefit periods. You have unlimited benefit periods throughout your lifetime. They start the day that you're admitted to a hospital, and they end 60 days after you're discharged. So in my previous example, let's say on day 100, I'm discharged, and 10 days later, I have to go back due to a complication. I'm still in the same benefit period, so I continue to pay that $644 a day until I've used up all my lifetime reserve days, after which point I'm going to be paying the entire cost out of pocket. Now, thankfully, most people aren't in the hospital this long. Now, what if I was admitted on day 100 and then 70 days later I go back in? It could be the same thing that I was treated for before. Because it's 60 days after I was discharged, a whole new benefit period starts. I pay the $1,288. Any questions on that?
What is the average hospital cost these days?
It's about $1,800 in Massachusetts. $1,800 a night.
So $1,800. It's a lot. So skilled nursing facility is slightly different. Now this is a medical reason as well. You have to have a medical reason to go in a skilled nursing facility. It's not custodial care only. So the first 20 days is 100% covered. This is covered if you go admitted to a hospital first for 3 nights and then you were sent from the hospital to the skilled nursing facility. So let me give you an example. My mother about 4 or 5 years ago was walking in the winter with a friend. February, slipped in some ice, she fell backwards, she broke both her wrists, okay? She had to go right to Cape Cod Hospital, ER, she was there for a few days. She went from there to a rehab place in Brewster. Because she did it correctly, she was at the rehab place in Brewster about 10 days. Now, obviously, she couldn't do anything with both wrists broken. It was fully covered by Medicare. So days 1 through 20, 100%. After that, it's $161 a day. After days 101, there's no coverage at all. You're on your own. Okay, that is Part A, the hospital care part of Medicare. So how about Part B? What's covered by Part B? Okay, this is, again, your outpatient care. Doctor visits, lab tests, emergency room, okay, the ambulance there to the emergency room service. A lot of rehabilitative therapies, excuse me, like physical, occupational. There's also more and more preventive costs paid for now by Medicare. Okay, the government recognizes it's cheaper to try to prevent some diseases and conditions, okay, than actually treat them. So you're looking at mammograms, prostate cancer screenings, flu shots. That's all covered by Part B.
So there's a couple different costs associated with Part B. There's the annual deductible, which for 2016 is $166 for the year. If you go to the doctor, you're also responsible for 20% coinsurance. But what most people usually associate costs with Part B are the premiums. So for 2016, this has been an interesting year. If you are collecting Social Security or know anyone who has, there was no cost of living adjustment. So years when this happens, there's something called a hold harmless provision that says if your Social Security benefits went up, we can't increase your Medicare Part B premiums. So for those folks who are collecting Social Security and on Medicare and had their Medicare benefits taken out of their Social Security benefits, they're paying $104.90 per month. That's the same amount that they were paying in 2015. Now for 2017, they're projecting a very small COLA cost of living adjustment as well. So those people paying $104.90 this year will probably pay a similar amount next year. For everyone else, so if you signed up for Medicare Part B for the first time this year, you're paying $121.80 per month. Unfortunately, it doesn't end there. If you have high modified adjusted gross income, then you're going to pay higher monthly premiums. So you can see on the screen the threshold for single and married individuals. If you fall into this, so if your adjusted gross income, if you think of your tax return, it's the number at the bottom, plus any tax-exempt interest, so if you own municipal bonds or have any other sources of tax-free income, if that number is in these thresholds, your monthly premiums per person can range from $170 to $389 per month. Now, the way that they figure out if you're impacted is they look at your tax return from 2 years ago. So for 2016, they're looking at your 2014 tax return to determine if you fall into these thresholds. So we see a lot of times when doing planning for clients is that all of a sudden their Part B premiums spike and they want to know why. Looking back a couple of years, you see maybe they sold a home, maybe they had a large capital gain. It just boosted their modified adjusted gross income for 1 year. but their premiums are going to go up. But they look back every year. So if you have a year where they go up, the next year, so 2017, they're going to look at your 2015 tax return. So it's sort of a rolling premium that you're paying. But most Medicare beneficiaries actually pay the minimum, about $1 to $490.
Yeah, I believe it's about 5% that could fall into the higher
Right.
category. Okay, finally we have Part D, okay, which is relatively new, only about 10 years old. This is a voluntary prescription drug plan, okay, so you do not have to take this plan, but it's something that's offered to help you control your prescription drug costs. You have to be enrolled in Parts A and B of Medicare to qualify and get Part D. This is something you contract with separately with an insurance company. So you pay that insurance company directly, you would get a card, a prescription drug card. There is a penalty if you wait to enroll. It's 1% higher per month that you delay enrolling. So let's say you're 65 years old and you're healthy, you have taken no medications. It's hard to imagine, but we do actually see quite a few people who take no medications at 65. So they're like, why do I need a prescription drug plan, okay? But let's say 2.5 years go by, 30 months go by, and then all of a sudden they get a condition that requires them to have medication and they need prescription drug plan. The cost of their plan is going to go up by 30% based on the average cost of the plan in the country. So if it's $40, okay, they waited 30 months, it'd be 30% higher. $12 more a month for the rest of their lives. Okay, so they're trying to incentivize you to get on a prescription drug plan. And talking to someone tonight, we'll talk about Shine and the wonderful work they do in Cape Cod. You know, there are very affordable plans you can get, okay, to get on some prescription drug plan to kind of insure yourself if something happens down the road, okay? So it is an important part of any kind of strategy in healthcare is, we believe, getting a prescription drug plan.
And Shine is a local resource. It stands for serving the health insurance needs of everyone. Our colleague Beth Grady does have some of their brochures. We really encourage you to take use of their services. So Part D is probably the most complicated in terms of what you're actually going to pay out of pocket. So there's a monthly premium that you pay throughout the year. In Massachusetts, these vary from about $20 to $120 a month. What you pay isn't dependent upon your income, it's just the services that the plan provides. So in addition to the monthly premium, there's a deductible and co-insurance. So the deductible for the year for 2016 is $360. So you're paying the first $360 out of pocket. Once you reach that, you're entering the initial coverage period. Here you're paying 25% co-insurance for your prescriptions. The plan kicks in 75%. You continue to pay the co-insurance until total costs of equal $3,310. Once you reach that point, you enter something called catastrophic coverage, or the donut hole. Here, your co-insurance jumps up to between 45 and 58%, depending upon whether you have brand name or generic drugs. You'll continue to pay these co-insurances until total costs have reached $4,850. At which point, the coverage gap, catastrophic coverage is the last period. At this point, your co-payments drop down again. So what you pay for Part D coverage really depends upon the prescriptions that you take. Medicare.gov does have a Part D plan finder, so if you go in, you can actually enter in your medications. They'll tell you which plan makes the most sense for you. To further complicate things, each plan has something called a formulary. It's the prescription drugs that they cover. Each year they can change that. You'll get a notice in the mail, so you want to make sure that what medications you're taking are covered. There is a period where you can actually switch Part D plans, which we'll talk about momentarily.
So, strategies for approaching healthcare costs in retirement. We think there's really two paths you can take. So let's make this easy, two paths. Path one starts with original traditional Medicare, Parts A and B we just outlined. You add on to that a prescription drug plan, Part D, and furthermore you add on what's called the supplemental plan or Medigap policy. Because Medicare, remember, you're on the hook for 20% of the costs, in outpatient costs. So if you had expensive procedures, say it costed $100,000, like a traditional healthcare plan, we might be capped. Medicare, you're not. Okay, you have to pay $20,000. So that Medigap policy will step in to pay for that 20% copay, okay, which can be catastrophic if costs were high for someone's retirement plan. So that's path one. You'd actually have 3 different insurance cards in path one. Now how about path two?
So path two is a Medicare Advantage plan, also referred to as Part C. By law, it has to at least include Parts A and Part B. Most Massachusetts plans include Part D prescription drug coverage. There are some fringe benefits as well. So this is really a roll-up. It functions similar to plans you might have before retirement, those that are offered by your employers. Most folks actually tend to go with path one versus path two, but I think we're seeing more folks
going to path two
shifting to path two now.
So path one, the Medigap plan. Okay, remember this is the one that supplements your Parts A and B. Okay, so this comes in where Medicare does not. Okay, this pays all your deductibles, your co-pays, and the 20% co-insurance. It's called the Medicare Supplement Plan. A lot of states have multiple different plan offerings, different letters. Massachusetts only has two. Okay, it makes it a lot simpler in this state. The Supplement Core, or basically basic plan, and the more comprehensive Supplement 1. Those are the two choices in Massachusetts. So what's the difference? Well, you can see here is Medicare Part A, where it covers right here, Part A and Part B. So in terms of, Melissa went through the hospital costs. The more extensive pays for all those deductibles, okay? The first 60 days to 60 to 90 days. Skilled nursing care, again, 20 to 100 days it pays for. The more basic just steps in after day 60 in the hospital care. It does pay the 20% co-insurance, both of them. One important point to know in the planning standpoint in Massachusetts is that you can switch from the Supplement Core to the more extensive Supplement 1 with a month's notice. Okay, so if you know you're going to have an expensive surgery and say be in a skilled nursing facility and you can schedule it, you can call your insurer and switch and upgrade to the more comprehensive plan, okay, which could save you a lot. Costs right now we see around say $90 on average for core, maybe $180, $200 for Supplement 1, but they're wide ranging depending on the plan, okay, and the provider. In your packet tonight, every year Massachusetts releases in January all the Medigap, okay, and Medicare different plans. That's listed in your packet tonight. So you can see the costs, and there's a huge range of costs depending on the plan.
So Path 2 with Medicare Advantage, you have a choice of two plans. In Massachusetts, a lot of the plans are HMOs. Again, a lot of us, before we retire, have HMOs through our employers. With these, you have to designate a primary care physician, and all referrals have to go through them. You have to stay in the network. If you go out of the network, then you're going to pay the full cost out of pocket. The other choice that you have is a PPO, a preferred provider plan. You can have a physician of choice. You don't need a primary care physician, so you don't need referrals to go to different specialists. If you go out of network, you won't have to pay the full cost, but you will have to pay more than staying in network. So with an HMO plan, you're also sort of stuck in the area where you are geographically. So if you're traveling and need services, the only time the HMO will kick in is if you have to go to the emergency room. Otherwise, you're going to have to pay for it fully out of pocket. So Medicare Advantage, as I mentioned earlier, it has to include at least Parts A and Part B, so hospitals and doctors. A lot of them include extra benefits, vision, hearing, dental. What you pay for Medicare Advantage plan depends upon the services that are provided. In your packets, as Jonathan mentioned, it does outline the different plans in Massachusetts, and you can see they really run the gamut in terms of monthly premiums. You're still paying Medicare Part B directly, so whatever you're paying based upon your modified adjusted gross income will continue to be deducted from your Social Security benefits. If you are 65 and not collecting Social Security, then you'll get billed directly. You pay Medicare in 3-month increments. There's higher deductibles with Medicare Advantage plans, so you might have an annual deductible that you have to reach before the plan kicks in, but out-of-pocket costs are limited. There's a set limit that you would have to pay out of pocket each year. And again, in Massachusetts, most plans provide drug coverage, so you have one card, you sort of have a suite of services under this path.
Now, a lot of times people refer to Medicare Advantage as Medicare Disadvantage. Now, why do they call it this? Okay, is it a poorer plan? Well, there are some differences we want to highlight with you. Okay, one, your services are limited. The way it works is the insurance companies are reimbursed a set amount per person on the plan by the government. So they're really not incentivized to offer a lot more in the way of additional services. Okay, referrals are required within the network. Okay, so there could be a better doctor in the out of network. This is just what people think. You may not get a referral to that doctor. They're encouraged to more do it in the network. Geographically, as Melissa mentioned, you're limited to your area. Okay, so if you travel a lot or you vacation down in Florida a lot, Medigap plan may be more preferable for you. There are higher co-payments and co-insurance. So if a medical condition does arise, a lot of people who are healthy say go on Medicare Advantage. It's a cheaper option generally. But all of a sudden, a medical condition arises, the co-payments and co-insurance can quickly escalate, and they can really add up. Okay, so that can happen there.
So whether you choose Path 1 or Path 2 is ultimately based upon your own personal situation, your health, and your finances. So just to recap what we've talked about this morning, in terms of costs, Medigap has a higher monthly premium. So again, in Massachusetts, this can range from $100 to $200 a month per person, depending upon whether you do the core or the supplement. Lower out-of-pocket expenses. So there's a lot of gaps left by traditional Medicare Parts A and Part B. Medigap policy is going to help pay for those so you don't have to pay for them out of pocket. With a Medicare Advantage plan, there's lower premiums. Some plans have a $0 premium. All you're paying is Part B. You don't have to pay anything additional. higher out-of-pocket expenses. So as I mentioned, there are annual deductibles that are a little bit higher. Convenience. As Jonathan said, with Medigap, you can go anywhere. So if you're going to be traveling, if you're spending part of the time in the winter in Arizona or Florida, Medigap is going to go where you are. Medicare Advantage is geographically limited. There's a network of preferred providers. So again, if you want to go see a specialist, you have to go through your primary care physician. So again, really dependent upon your lifestyle, how much you're willing to pay, how much you can budget for to cover these expenses.
Any questions at this point? Okay, the final part of today's workshop on healthcare costs is Medicare enrollment. What are the enrollment periods? What do you need to know in terms as far as enrolling in Medicare and other plans? So the initial enrollment period starts based on when you turn 65. Okay, so let's make an example here. Let's say your birthday is September 15th. There's a 7-month enrollment period. Starts 3 months before your birthday, so here June 1st, includes your birthday months, and then 3 months after your birthday. What's important to remember here, if you delay and say you don't enroll to November, it can take a few months to process. So you enroll in November, it's not going to start the next week. So really encourage you to enroll before you turn 65. Okay? Be aware of that date. You want to enroll before you turn 65 so you don't miss coverage or have a gap in coverage. And one other important thing to learn, I learned at Shine, is that if you're born the first day of the month, your birthday month is actually the month before. So here, if you were born, say, September 1st, they actually think you were born in August. Don't ask me why. Social Security works the same way, by the way, okay? So you slide it back. In case anyone was born the first day, wouldn't want you to forget that.
All right, so next is open enrollment. This is going to be happening soon. It's annually from October 15th to December 7th. During this period of time, you can either you can change Part D plans, you can change Medicare Advantage plans, or you can enroll in Medicare Advantage for the first time. So we talked about Medigap, which is Path 1, the supplement. This open enrollment, it's a 6-month period that begins when you're 65 or older and enrolled in Medicare Part B for the first time. You really want to try and enroll in Medigap during this period because it avoids underwriting. So if you have any pre-existing medical conditions, they can't deny coverage or increase premiums based on your health conditions.
And finally, there's a special enrollment period. We see this more and more. Okay? And in the old days, a lot of people retired in their 60s, early 60s. Now we see people working into their 70s. So the question that comes to us a lot is, let's say I'm on a group health plan, right, with my employer. Do I need to go on Medicare? Well, if you stay on your group health plan, you don't go on Medicare, let's say, okay, and let's say you're 68 years old. When can you enroll in Medicare? Well, this is called the special enrollment period. So you're not penalized at all for delaying because you are covered by a health care plan. This starts when you stop working or health care coverage ends, whatever comes first. Okay, at that point, you have 8 months to enroll in Parts A and B. And you have 2 months to enroll in Parts C and D. So here, if you stop working on April 15th, you have the end of June 30th to enroll Parts C and D, and you have through December to enroll in Parts A and B. It's called the special enrollment period.
And finally, just a couple of important takeaways in terms of planning for Medicare. Determine which path best meets your need, Path 1 or Path 2. Be aware of the various enrollment periods so that the penalties for some of those don't follow you for the rest of your life. And finally, make use of local and online resources. We mentioned Shine, Medicare.gov has the plan finder. We've included some information in your packets too to help you in the process.
Yeah, we really think there's 2 steps going forward. So step 1, you can sign up with us for a complimentary retirement consultation. We can look at Social Security specifically and how you can afford healthcare costs in retirement. Step 2, I would go for healthcare right to a Shine, okay? Go through your local council of aging, make an appointment to sit down with someone through Shine, discuss your healthcare options specifically.
Right, and part of Cape Cod 5's mission is to provide financial education to everyone. Part of the reason why we do these workshops, we did one in the spring on Social Security, is very well received. A lot of people did take advantage of the consultations, so we've really covered a lot of information this morning. If you have questions specific to your information or would like us to run retirement projections for you, we do offer those complimentary services. And Jonathan and I, as Karen mentioned, are both certified financial planners, so we'll just sit down with you for an hour and provide you with a roadmap and some recommendations to meet your goals. So thank you, everyone, for coming this morning. Nantucket and Hyannis, thank you as well. Yeah. And we'll be around to answer any questions.
Thank you.
Do you think I might go?
I don't know.